Have you ever bitten into an apple or a piece of crusty bread and suddenly wondered, was that tooth always this loose? It's a frightening feeling. For many people, the first thought is, I'm going to lose my teeth. Some assume it's simply part of getting older. Others hope the feeling will disappear on its own. But here's what I've learned after more than 30 years as a dentist. Teeth don't usually become loose overnight. In most cases, they've been sending quiet warning signs for months, sometimes even years. The question is, did anyone notice them? Today, I'd like to explain why teeth can begin to feel loose after 60, what's really happening beneath the gums, and why early action can often make a remarkable difference. Hello, I'm Dr. Daniel Brooks. One of the hardest conversations I have with patients begins with a simple sentence. Doctor, one of my teeth feels loose. I can hear the worry in their voice. They're already imagining dentures, extractions, expensive treatment. But the truth is, a loose tooth doesn't always mean it's too late. Sometimes it's your body's way of asking for help before permanent damage occurs. Let's begin with the most common reason I see in my practice. Reason number one, your gums are the foundation of every tooth. When people think about teeth, they usually picture enamel, the white part you see in the mirror. But teeth don't stay in place because of enamel. Imagine building a beautiful house. The walls may look perfect. The roof may be brand new. But if the foundation underneath begins to weaken, the entire house becomes unstable. Your gums, the surrounding bone, and the tiny periodontal ligaments act as that foundation. They're constantly holding every tooth firmly in place. When those supporting tissues stay healthy, your teeth feel solid. You hardly think about them. But when inflammation develops, the support system slowly begins to change. At first, you won't notice movement. Only the dentist can detect those tiny early changes. Months later, your tooth may begin feeling slightly different when you chew. And by the time it actually feels loose, the problem has usually been developing for quite some time. That's why healthy gums are about much more than preventing bleeding. They're protecting the very structure that keeps your teeth where they belong. But inflammation doesn't appear without a reason. Something has to start the process. And surprisingly, the cause is something soft, almost invisible, and incredibly easy to underestimate. Reason number two, plaque may look harmless, but it isn't. Run your tongue across your teeth before brushing tomorrow morning. That slightly fuzzy feeling, that's plaque. It isn't food, it isn't toothpaste. It's a sticky film filled with bacteria. Left alone, those bacteria begin irritating the gums day after day. Your immune system responds by creating inflammation. At first, the gums may bleed while brushing. Then they may become swollen. Over time, the inflammation can begin affecting the bone that supports your teeth. Here's what surprises many patients. Bone loss doesn't usually hurt. You can't feel it happening. There are no alarms, no flashing warning lights. Everything seems normal, until one day, a tooth suddenly feels different. That's why plaque should never be ignored simply because it looks harmless. The damage it causes often happens quietly. So far, we've talked about gums and plaque. But there's another hidden reason teeth may start feeling loose after 60. It isn't something you can see in the mirror, and it surprises many of my patients when I explain it. So far, we've talked about your gums and plaque. But there's another hidden reason teeth can begin to feel loose after 60. It isn't something you can see in the mirror. In fact, many people don't even know it's happening. Reason number three, bone loss happens silently. Imagine a large oak tree. From the outside, its trunk looks strong. Its branches are full of leaves. Everything appears healthy. But underground, the roots are slowly disappearing. Eventually, even a healthy-looking tree becomes unstable. Your teeth depend on the jawbone in much the same way. Every tooth sits inside a socket surrounded by bone. That bone isn't permanent, it's living tissue. It constantly rebuilds itself throughout your life. But when chronic gum inflammation continues for months, or even years, the body can begin removing small amounts of bone around the teeth. Here's the difficult part. Bone loss rarely causes pain. Most people never realize it's happening. By the time a tooth feels slightly loose, a significant amount of support may already be gone. That's exactly why routine dental x-rays are so valuable. They allow us to see changes long before patients can feel them. I've had many patients tell me, "Doctor, I had no idea anything was wrong." And they're right. Because bone loss is one of the quietest conditions in dentistry, but sometimes the problem isn't only underneath the gums. Sometimes the force coming from above is just as damaging. Reason number 4, grinding your teeth while you sleep. Let me ask you something. Have you ever woken up with a sore jaw, a headache, or teeth that feel strangely sensitive in the morning? Many people assume they simply slept in an awkward position. Sometimes, the real reason is much different. During sleep, some people unknowingly clench or grind their teeth. Night after night, those powerful forces place enormous pressure on the teeth and the tissues supporting them. Think about bending a paperclip. One bend doesn't break it, neither do 10, but hundreds or thousands that eventually weaken the metal. Your teeth experience something similar. Healthy teeth are incredibly strong, but constant grinding can overload the ligaments and bone that keep them stable. One patient came to see me convinced his tooth was failing. After examining him, the tooth itself was healthy. The real problem was severe nighttime grinding. Once we fitted him with a custom night guard, his symptoms gradually improved. Sometimes protecting your teeth while you sleep is just as important as cleaning them while you're awake. Now here's something many people never consider. It has nothing to do with brushing or flossing or even grinding. Sometimes the problem starts after you've already lost a different tooth. Reason number 5, missing teeth change the way your entire mouth works. Every tooth has a job, and every tooth depends on the others. Imagine removing one support beam from a bridge. The bridge doesn't collapse immediately, but the remaining supports suddenly have to carry more weight. The same thing happens inside your mouth. When one tooth is missing, the neighboring teeth slowly begin shifting. The bite changes. Chewing forces become uneven. Some teeth work much harder than they were designed to. Over time, that extra stress may contribute to mobility in certain teeth, especially if gum disease is already present. This is one reason dentists often recommend replacing missing teeth whenever possible. Not simply for appearance, but to help distribute chewing forces more evenly throughout the mouth. Your teeth work best as a team. When one teammate disappears, everyone else has to work harder. We've uncovered 5 common reasons teeth may begin feeling loose after 60, but there are still 2 more. One is closely connected to your overall health, and the last one may determine whether a loose tooth can still be saved. We've talked about plaque, bone loss, grinding your teeth, missing teeth. Now let's look at 2 final reasons that many people never connect with loose teeth, and one of them may surprise you. Reason number 6. Your overall health affects your teeth more than you think. Many people think the mouth and the rest of the body are completely separate. They aren't. Your gums are living tissue. Your jawbone is living tissue. Everything happening in your body influences them. For example, poorly controlled diabetes can make it harder for the body to fight infection. Smoking reduces blood flow to the gums. Certain medications may cause dry mouth, allowing harmful bacteria to multiply more easily. Even conditions that weaken the immune system can make gum disease progress faster. I've had patients tell me, "Doctor, I brush every day. Why is this happening?" Sometimes their brushing wasn't the problem. Their overall health was making it much harder for their gums to heal. That's why good oral health isn't just about toothbrushes. It's about taking care of your entire body. Healthy habits don't stop at your smile. And finally, there's one mistake that causes more unnecessary tooth loss than almost anything else. It isn't poor brushing. It isn't bad genetics. It's waiting too long. Reason number 7, waiting until the tooth becomes painful. Imagine seeing a small crack in your home's foundation. Would you ignore it until the entire wall collapsed? Probably not. Yet that's exactly what many people do with their teeth. A tooth feels slightly loose, but it doesn't hurt. So life goes on. Weeks become months. Months become years. Eventually, the tooth becomes much looser. Chewing becomes uncomfortable. Only then, the dental appointment gets scheduled. One of the hardest things I ever have to tell a patient is, "I wish we had seen this 6 months earlier." Not because I enjoy saying it, because it's often true. Many loose teeth can be stabilized when treatment begins early. The longer inflammation continues, the more difficult that becomes. Your body usually whispers before it screams. The earlier you listen, the more options you may have. So, can a loose tooth be saved? The answer depends on one important question. Why is it loose? If gum disease is caught early, professional treatment combined with excellent home care may help stabilize the tooth. If grinding is the cause, protecting your teeth at night may reduce the excessive pressure. If a bite problem is placing too much force on one tooth, Small adjustments can sometimes make a significant difference, but none of those solutions can begin until the real cause is identified. That's why guessing at home is never the best plan. A proper dental examination is the first step toward protecting your smile. Here's something I'd like you to do today. Using a clean finger, very gently touch each tooth. Don't try to move it, simply pay attention. Does one tooth feel different when you bite? Does one area feel uncomfortable while chewing? Have your gums been bleeding more often? Small changes matter. You don't need to panic, but you also shouldn't ignore them. A simple dental visit today may prevent a much bigger problem tomorrow. One loose tooth rarely appears without a reason. It's usually the final chapter of a story that has been developing quietly over time. The encouraging news is that many of those stories can be changed. Healthy gums, regular cleanings, gentle brushing, daily flossing, managing your overall health. These aren't dramatic solutions, but together, they create the strong foundation every tooth depends on. Thank you for spending these few minutes with me. If you enjoy practical dental advice explained in clear, simple language, I'd be honored to have you join me by subscribing to the channel. I'm Dr. Daniel Brooks. Take care of your gums, protect your bone, and give your teeth the support they'll need for many years to come.